For continuing to tune in. Appreciate you paying attention to these press conferences and getting the information you need as we continue to deal with the coronavirus in Rhode Island. As a quick reminder, tomorrow's press conference will be at 2:30 instead of 1 o'clock, and then we'll be back the next day and every day at 1 o'clock. So we'll begin, as we always do, with a quick look at the data. The data should be on your screen. And it's a good news story. Again, we're starting to see a decline in the number of cases. Today we're reporting 134 new cases. Very sadly, 26 additional deaths. So again, I would ask everybody in Rhode Island to bear in mind those who have lost loved ones during this incredibly difficult time. I want to just continue to ask everybody to keep following the rules. So I know it's not easy. Keep wearing your masks, washing your hands, getting tested if you're sick. Above all, stay home if you're sick. Really, stay home if you're sick. This is not just about keeping you safe. You know, I've heard some people say, well, I'll just take the risk. It's not just about you. It's about everyone else. It's about you spreading your germs and getting other people sick. And so I'm just asking you, this is life now. This is our life. I can't change the virus. We can't change the virus. We can learn how to live with it, though. And so just don't fight it. Live within the new rules, and we're going to be able to keep going back to life, out to dinner, going back to work, and doing what we want to do safely as long as we keep following the rules. Okay, so today I have an announcement that I'm actually very excited about because we've been working on it for a long time, and it's going to be a tool that really helps Rhode Island. We are rolling out today, a new phone app that'll help us deal with the coronavirus. The app is called Crush COVID. So it's Crush COVID RI. I love the title because we are crushing COVID. And it's a one-stop app that is going to help us do symptom monitoring and test ordering, get your information, and do contact tracing. It's now available for free download at the Apple App Store and Google Play in both English and Spanish. So take a half a second, takes 5 seconds. I did this yesterday. It'll take you 5 seconds. Go to the App Store, Google Play, Crush COVID RI, download the app on your phone. We are the first state, or one of a few first states in the country, to roll out a one-stop app of this kind. And I'm going to take a couple minutes now to review for you exactly what the app does and why I'm so excited about it. You know, I've been saying that. People keep saying, when can we go get our hair cut? When can we go back to church? When can we do this? Some of it has to do with our cases. A lot of it has to do with our systems, our getting ourselves ready. And this app is going to be very helpful. Before I explain what it is, I have to say thank you to so many people. The first thank you goes to BJ Kumar and Chirag Patel, who work for the state. These guys have worked with their teams truly 7 days a week, around the clock, to produce this app. So to Chirag and BJ and your teams, thank you. This is a homegrown app. We have worked and collaborate our own team at the state in collaboration with a local company, Infosys. We brought Infosys to Rhode Island a year or two ago, and they have an operation here. Ravi Kumar is his senior person there. I reached out to him. I said, help us out. And they have, for free, been working around the clock with us to develop this Crush COVID app. So this is a public-private partnership, and it's going to be a tool that'll help everybody in Rhode Island get through the crisis. So what's it going to do for you? The first thing is it tells you where to get resources. So as we go through the crisis, different people will need different resources at different times. If you need food delivery, you can figure out how to get that done on this app. If you're a healthcare worker and you don't feel that it's safe to live in your house, you need to find a free place to live, you can find that on the app. If you have tested positive and you don't have anywhere to isolate safely, you can find that here on this app. So just it's a constant at your fingertips place to go get resources and figure out the resources we have available. If you're elderly, if you're a veteran, if you're a healthcare worker, it's all here for you to access. It also provides information. So I have said from day one, knowledge is power. Keep yourselves informed. And it changes. Every day there's new information. We learn more about the virus. We learn more about our ability to adapt to it. So you want to have that information constantly updated at your fingertips. So all of that information is in one place on this app. This press conference, for example, will be streamed there on the app. We're putting news updates. The Department of Health will put updates there. So I would really encourage you to stay up to date so you can keep you and your family safe. Testing. So because of a lot of hard work, Rhode Island is #1 in America for our testing. More tests than per capita than any state in America. At this point, we've tested almost 12% of our population. So we want to stay ahead of the curve with testing. How do we do that? We got to have folks have access to testing. You can go on this app and you can schedule a test. You can figure out where you can get a test and you can schedule a test. And there'll be a number of ways to do that through your primary care physician, at the CVS site in Twin River, one of the walk-up sites. And this is really important. As the months go on, we're going to change the way we do testing because we want it over time to be all driven through our healthcare system. Ideally, everyone who wants to get tested or needs to get tested should have a connection to a healthcare provider. So this app will be constantly updated so you can find out where to get a test, how to get a test, and order your tests. Symptom tracking. It is critical. If we're going to stay ahead of the virus, we need to know about outbreaks, before they happen. So the app will prompt you, I think, once a day to take a 10-second survey. How are you feeling today? What are your symptoms? Do you have a fever? If everybody does that, we over time are going to get a good view across the state of are there schools or neighborhoods or regions or buildings where we see problems in symptoms, and that will enable us to react quickly to those issues. I took the survey yesterday. It takes a few seconds, and you do it every day. And then the key thing is what we're calling the location diary, and that's what is in this app. So for a month and a half, I've been up here every day asking you to keep your contact tracing notebook. I've asked you in that notebook to write down where you've been and with whom you've come in contact. That can be hard to do. Sometimes you forget to do it at the end of a day, you forget where you've been. So this will make that easier. On the Crush COVID app, there is a location diary feature. It's called My Location Diary feature. Here's how it works. When you open the app, it'll ask you, do you want to enable the My Location Diary feature? It's your choice to say yes or no. If you say yes, the app will create a map of places you visit in a day where you've been for 10 minutes or more. So it's kind of like a Google map. If you are in any location for 10 minutes or more, it'll show up automatically logged on your app. So at the end of the day, at the end of any day, or any 3 days, or any 5 days, you can pull up your own location diary, and it'll have a list of all the addresses where you were for more than 10 minutes in that period of time. If you do choose to enable the location diary, the data around where you've been, is stored on your phone only. That's really important. It's only on your phone, and it's only if you enable it. And it is automatically deleted after 20 days. Not stored in a database. Infosys, the company, has no access to it. Apple has no access to it. No company has access to it. It's just literally on your phone, automatically deleted within 20 days. Available only to you. Now, if you get sick, you get the coronavirus, you'll get a call from the Department of Health, and the contact tracer will ask you, would you share your location diary? So then that's another point at which you decide. You could say, no, I won't share it, but you could read what's in your phone to the person at the Department of Health. Or you could say, yes, I will share it, and it will be shared. At that point, your location data will be shared with the Department of Health without your name. It'll have an ID number, not your name. If you give permission, the data will go to the Department of Health, never to a company, never to any other state or federal agency, only at the Department of Health, without your name. And that information will be used for the exclusive purpose of doing contact tracing in COVID-19. Why am I saying all that? Because when I started this, I said to the team, I need you to make something that tracks contacts and enables us to keep a lid on the virus, but protects people's privacy and data in an ironclad way. And so that's what this is designed to do. Furthermore, this is completely your choice. No one is ever going to make you download this app. No one is going to make you turn on the diary feature. No one is ever going to make you share the data. I, however, am asking you to do this. I've done it. I'm urging my friends and family to do it. I'm urging the folks who work for me to do it. And I'm asking you to please download the app and enable the location diary feature. Why am I doing that? Because these systems only work insofar as everybody uses them. It's true, we all have our own privacy rights, we all have our own rights to live freely, except in this virus, we're all very connected. My desire and ability to breathe freely without a mask endangers you. And the same is true for this contact tracing app. It only works if everybody's using it, so that we can see where everybody is, because the name of the game is containing the virus. We can't stop it. We can only hope to contain it. And so if everyone's on it, we can quickly identify hotspots, get everybody tested, and everybody into isolation. I'm sure there'll be a lot of questions about it. I'm sure some people will feel uneasy about it. I'm happy to answer any questions. But if this works as intended, which is to say the majority of Rhode Islanders check their Crush COVID app every day, track their symptoms, order a test as soon as they need it, enable their location so that our contact tracing can be very effective, then I have a great deal of confidence that when we start going back to church and start going to the beach and start going to get our hair cut and start going out to dinner again, we can keep a lid on the spread of the virus and also, if there are outbreaks, react quickly. I want to say this. We're not a software development company, and I don't want to pretend that we are, so please don't expect the same level of slick functionality that you would for an app that you're going to get from the App Store. This is just a tool. This is a tool. It's meant to do its job and be, functional. Also, what we're rolling out today is not a final product. It's version 1. So I'm letting it out into the open. There will probably be glitches. You probably won't like certain features of it. Give it a try. Be patient. We're going to roll out another app in probably a month, another version in probably a month with some more functionality. But also give us your feedback. So we want to incorporate your feedback into version 2 of the product. And you can do that by visiting health.ri.gov/crushcovid. And if you have comments on how we can make it better, then send us your advice. My hope is that together, we, the people of Rhode Island, will, in fact, crush COVID. Okay, one last announcement, also a good news announcement. I'm moving us towards reopening child care centers on June 1st. That's a week from Monday. We have a lot of work to do, but we're on path. So the plan is as intended to start reopening child care June 1st. I have been in touch with a lot of businesses who say it's impractical to reopen business if there's no child care. So we're trying to respond to that need. As we reopen, asking for a little bit of patience. It's going to be different, but we're well on our way to enabling it. We have more than 900 child care settings in the state of Rhode Island. Every single one matters. Every child in every one of those facilities matters. And so we're trying to give them a hand. We're working hand in glove with them to give them guidelines, technical assistance, et cetera. But today I'm announcing that we'll be supporting child care centers with 50,000 surgical masks. It's just a way to help them get started, to give them 50,000 surgical masks to keep them safe and the kids safe, and give parents a sense of peace and comfort and confidence that it is going to be safe to return your kids to child care. I want to thank the SEIU 1199 and the Rhode Island Association for the Education of Young Children. They're going to be working with us in the coming days and weeks to distribute the masks, the 50,000 masks, to the 900 child care centers in the state, and from home daycares as well. So we have home child care providers and the big facilities. Everyone's going to get a mask. And we are going to do our best to make sure that everyone can open safely on June 1st. So I'll turn it over to Nicole, and then I'll come back for questions.
Thank you, Governor. Good afternoon, everyone. I want to echo the Governor's appreciation for everyone who worked so hard to help develop our new Crush COVID RI app. Rhode Island's COVID-19 response has been a story of tremendous collaboration, and this is just one more example of that. I also want to echo the Governor's ask and encourage you to find the app, join with me, download it today, use it, and give us your feedback. This is across the board: businesses, employees, students, all members of our Rhode Island community should really engage and participate in this valuable resource. We are one of few states that have it available. Let's take advantage of it and help together to crush COVID in Rhode Island. This is just one more way that you can support Rhode Island's response to COVID-19, and one more way you can help keep our communities healthy and safe. So that being said, we also recognize that some people are not going to be able to download and use the app because they may lack smartphone access. We stood up our COVID-19 hotline early in our response to be able to address access across the board. It's still a great resource for people who need it. The phone number is 401-222-8022. And for people who have internet access, but not smartphone access, our website, health.ri.gov/COVID, has links to many of the resources that are accessible through the Crush COVID app. We're going to keep engaging in dialogue with the community to make sure that everyone has access to the information they need. So to turn to the data, we have 134 new COVID-19 cases to report today. There are 247 patients who are currently hospitalized, and of those 247, 59 are currently in the intensive care unit and 44 are on a ventilator. We unfortunately have 26 additional COVID-19 associated fatalities to report this afternoon. These people ranged in age from their 50s to being older than 100 years old. One person was in their 50s, 2 were in their 60s, 7 people were in their 70s, 10 people were in their 80s, 5 people were in their 90s, and 1 person was older than 100 years old. Our condolences are with all of the friends, families, and loved ones of those we have lost. So I was asked a question about serology testing yesterday, so I want to turn to that for a moment. The update I have is that we are wrapping up the testing at the Stop and Shop sites on Friday of this week, and we're going to take a little time to analyze those numbers and should be back next week with information on what we saw, along with an update on the next steps we're going to take in partnership with our Rhode Island COVID-19 Testing and Validation Task Force. I want to thank all the people who came out and supported our response by participating. I know that serology and the diagnostic PCR testing and testing more broadly is something that has been of great interest to everyone. I also want to take a moment to reiterate that while testing is critical for us in trying to assess where we stand as a state, people need to interpret their individual test results with caution. And it's going to be our job to continue to make sure you have the science and education to be able to do that. And hopefully we'll be able to do that in support with a primary care provider, which is also what we want to encourage across Rhode Island. If someone is feeling symptoms, they need to self-isolate, continue to stay home, and recover safely there. If someone has been in contact with someone who has had COVID-19, they need to quarantine for 14 days. That means be able to stay at home and monitor themselves for symptoms to develop so that this way they are not out in public before symptoms develop or with symptoms when they develop. If you are a contact of someone with COVID-19 and then got tested and got a negative result, that does not mean that you are in the clear, because we know that a test is one point in time. We've used the term incubation period before. This is the time between when someone is exposed and when we start to see signs of illness, when we start to see symptoms develop. The incubation period for COVID-19 is typically on the long side. Sometimes it takes as long as 14 days. That's why the quarantining time lasts for that amount of time so that you can monitor yourself for symptoms effectively during the entire time period. So that's why if you were a contact of someone with COVID-19 and were told to quarantine, you need to carefully monitor for symptoms and stay in quarantine for 14 days, no matter what the test result has said. This is critical for all of us right now as we continue to understand how COVID-19 works and what are the steps we can do overall as a state and as individuals to gain the information we need to be able to stop further transmission. Over the next few weeks and months, we'll continue to share information, we'll continue to share the approach we are taking with testing and the early warning system of testing that we can use to learn more about how COVID-19 spreads across communities so that we can continue to stay in front of this. The governor shared where we are with testing as a state in the nation. With working together and following our guidance, we're going to continue to use that advantage to help us understand what we need to with COVID-19 and help you as individuals be able to have the right information for how to go forward. With that, we will crush COVID-19 together. Let's get started with questions. Thank you.
Go ahead, Tom.
Governor, what percentage of participation would be necessary in the phone track in order to make it useful for you folks?
That's a great question. We want 90+%, but anything is useful. Like right now we have nothing. Right now I'm asking people to write it down in a notebook. A lot of people are doing that. So I think any amount is helpful, because the way it would work is, let's say, you as an individual, it'll help if you have enabled the location diary when you get that phone call. It's going to help us very quickly identify all the places you've been and the people you were in contact with. So that'll help you and those people. Now, it'll multiply. It's like a ripple effect after that. So it's the more people that are using it, the more people we can help. But even 5% of the population, it'll help us. Every little bit will help.
Governor, on the app, you've got this ability to do the survey as well. Is that information going to be transmitted anywhere, or is that just simply in the phone? And then the second question, in terms of pinpointing where this is going, once somebody gets an app, will you know how many people have the app so you can determine, in fact, whether their locator has been turned on?
I think the answer to your second question is yes, but I need to get back to you on that. And the symptom tracking data will be kept by zip code. So the Department of Health will be able to have the data by zip code to see in a zip code, what the symptoms look like there. So it's a 10 to 30-second survey. It asks you to self-report. It then asks you for your zip code. So the Department of Health can see if there's any growing hotspots. So it'll be shared with the DOH on a zip code level basis. And I got to get back to you on your second question.
So it sounds like once you've, installed the app, you know that somebody's installed it and where they are.
Yes. If you enable the feature, yes. So you have to decide. The thing about this is you have to say, yes, I'll take the survey. Now, so you could say, no, I don't want anyone knowing my symptoms. Fine. And you have to enable the location diary. But yes, once that's turned on, then it stays on your phone, and then you could give permission for that data to be uploaded to us.
2 steps.
It's 2-step, exactly. First you have to sign in or accept it, say yes, and then you have to agree to share the data. So if you sign on and agree to share the data, then we know, all the information.
Despite your assurances about the privacy and you have to enable certain steps along the way, there's going to be plenty of critics who say this is Big Brother, I'm not signing up for this, the government is tracking me. What do you say to those people? Do you have any hope to reach those people who are like, I'm not doing this?
Yeah.
And to follow up on that question, is there any plan to audit the app from a third party to verify that what's in it is what's claimed?
I'll get to you in a second, because but first your question. I know I hear that. I hear it myself. Well, forget it. I'm not doing that. So listen, I can't force you to do it. I'm not going to try to force you to do it. It's completely your choice. And if you feel uncomfortable, then at the bare minimum, keep your contact tracing notebook. At some level, it's like all of this, Brian. At some level, I can't really force everybody to wear a mask. Can't really force everybody to wash their hands and stay home if they're sick and be apart for six feet. But I know if everyone does it, then our economy will be stronger and folks can stay at work and we can get the kids back to school. So what I would say to you is get smart about the app. Just learn the facts yourself. Ask us whatever questions you have. Learn about it. Try to get yourself comfortable with it. Try to get your questions answered and try to get yourself comfortable with using it. Because the more people that use it, back to the thing about symptom tracking, if we have 60% of people in a particular zip code using it, it's just going to be better information than if there's only 2% of the people in a zip code using it. So it's in the best interest of Rhode Island's healthcare and economy if people use it. Learn about it. I'm asking you to try. I'm asking you to be open-minded. My ask is to be open-minded. If after doing all that you just can't stomach it, then I appreciate that and I respect that.
It's very easy to navigate. One of the things, after 20 days, it deletes your information, or you could delete. People have been hearing normally it's a 14-day. Was there some discussion about why the 20 days?
Do you have
Sometimes it's helpful to have that additional information in specific cases. If someone has been re-exposed, it may be extended over a time that's slightly beyond 14 days. So the 20 gives us a little bit of a grace period so that we can collect the additional information if it happens to be helpful in a specific scenario.
Infosys, you're doing this in real time. Social media is saying, you know, this company's in India. All your information goes back to India.
Not true. So, not true. The company is headquartered in India. They also have a sizable office in Rhode Island. The data stays on your phone. The data is on your phone. Infosys does not have access to the data. They will never have access to the data. There is no database of the data. It lives on your phone until the point where you get a call from the Department of Health and they say, hey, John, would you be willing to share your data with us? If you say yes, then the data goes to the Department of Health without your name. There is never a place that your data is held in a database with your name. So those are the facts. So that's to your question too. It's a two-step. It's designed as a two-step. So at every point, you have the choice. You decide. I suspect there'll be lots of people, this goes to Brian's question, who would say to the Department of Health, no, I'm not going to transfer my data, but I'll read it to you from my phone. And that's good too. It's not as good, but that's good too.
Just from what I've seen, there's a lot of information on here. If someone is listening or watching and they say, hey, I have a service that I'd like to be added, who do they contact for something like that? Because I noticed there's food delivery. I mean, it's almost like an A to Z of everything you need to know.
Yeah, thank you. So that's the plan. The point is it's an A to Z of everything you need to know in one place. It would depend. You could call Commerce, 521-HELP if you have a commerce thing. You could call the Department of Health if it's a health service. You could just go to the thing that I referenced, the health.ri.gov/crush-COVID. That's where we're seeking input on the app. So if you think something should be added, let me know. We'll try to add it.
Kim and then Bill. Governor, it might be too soon for you to say, and I know some of this is also included in the different phases, but your executive order on domestic travel and quarantine, as well as no dine-in restaurant service, no close contact or entertainment businesses, is set to expire at the end of this week. Do you foresee extending all or part of that?
So they expire Friday, and on Friday, I plan to address that. I hope to be in a position on Friday to address that and start to give some guidance about phase 2.
Doctor, just a quick question for you on today's death toll. It's the highest single day number of deaths that we've seen. Can you tell us why it's so high and if some of these deaths occurred previously?
Yes, about half of the deaths are from previous days leading up to this, and half are from within the last 24 hours. The demographics continue to be the same. It's really about being able to get the laboratory results that associate someone's unfortunate death with COVID-19 that then leads to them being added to the number.
Can you give us an update on nursing home and congregate care related deaths?
Yes. Unfortunately, we have about 24 of the 26 unfortunate deaths that have happened were associated with an assisted living or a nursing home facility. We are continuing to update our long-term facility data online weekly on Wednesdays. And so as of last Wednesday, we had roughly 2,100 resident cases in these facilities and roughly 350 unfortunate deaths. So we're continuing to work aggressively and closely with our congregate care settings to respond to this pandemic.
Is there any reason you might be seeing a new spike in those numbers where they kind of leveled off or evened out for a bit and have now gone back up?
Yeah, there isn't anything new that's happened statewide or from an epidemiological standpoint. We do know that we're continuing to do the aggressive and proactive early warning system testing throughout our congregate settings, and continuing to provide the PPE and support for residents and facilities as they go forward. It just continues to remain a very challenging mixture of a disease that directly impacts older and medically or physically frail individuals that have a higher risk of spread in a congregate setting.
Doctor, given two questions actually on extrapolating data. Number one, with the app rollout, many of the most vulnerable or susceptible populations are probably, like this is just a guess, folks that don't use a smartphone regularly. We're seeing also situations where there's high numbers in places where more than English and Spanish are spoken commonly. How far away are we from having a contact tracing system that is all-encompassing, particularly in those populations that are most vulnerable? Secondly, tying that together with the data extrapolation, if healthcare worker X tests positive on day 1, then on day 7, that same healthcare worker again tests positive. Does that count as 2 positive tests in the grand total that we see on a daily basis?
Great. So starting with the second question, we are only counting that individual once in terms of a positive test, unless, of course, the individual recovers completely, has a negative, and then is re-exposed. Then it may be a second, but as you described, day 1 and day 7, that would essentially be one test. So we are deliberately focused on making sure that our communities of color that are disproportionately impacted with COVID-19 continue to have the same access to the services, to the information that's needed as everyone, and even more because of the disproportionate impact. So this is the first version of the app. We will definitely look to, with subsequent versions, help to make sure that it has opportunities to be able to communicate with all communities. It's also why I shared the COVID-19 hotline, because we want to make sure whether you have internet access or whether you have a phone app, you still will have access to services. We also have multiple languages, definitely Spanish, available with the COVID-19 hotline, and are focused on continuing to provide translation services across the number of languages that I shared yesterday. With our continuous engagement with the community, we want the feedback to continue to hear what is needed to make sure, particularly the communities of color and the communities that are most impacted, have the direct access to the information and resources they need.
Regarding the app, if someone allows the Department of Health to access their location, is that in real time? And if so, will the Department of Health use that data to pinpoint where people are gathering in large groups?
Absolutely. If it is shared and we're able to then be able to do the contact tracing in the real time that we would need it, because that is the key, we can then use that to understand, are we seeing clusters of groups? How can we be even more pinpointed? Where else should we go with our response team that goes out to do additional testing? It's extremely valuable information, and the advantage that we have as Rhode Islanders with this Crush COVID-19 RI app is it allows us to respond quickly. That is the key to our effectiveness with COVID-19. As soon as we can understand someone has symptoms, as soon as we can get them safely isolated and reach out to their contacts and get them quarantining, the better we can be at stopping transmission from one person to another.
And you can open the portal and see, oh, there's a huge group of people at India Point Park, for example. Can you see it in real time like that?
We would more so do that on the individual level as we're collecting the information. It doesn't give us the group information through the app, but as we're talking to the individual and getting an understanding of where they were, a normal part of our outbreak response is to do the epidemiological detailed linkage of understanding, well, there have been 3 individuals now that have been associated with this particular location. Let's be pinpointed in our overall response and activate.
Can the app be used to see if somebody's breaking a quarantine? Like, can you track somebody and realize they've been moving around when they're supposed to be at home?
It is not at that level at this point. And we're hopeful that it's more so just going to be to help us with the contact tracing and help support individuals as they need it.
Can I answer that?
Sure.
So this version 1 is not a real-time tracking tool. It stores the data on the phone. For example, I downloaded mine yesterday, and today, when you look on it, and it says, where have you been in the past 5 days? I've been at 2 places, my house and the office. So it shows you, this is where you were for an hour and a half or more than 10 minutes. This is your address there. This is your address now. That is stored on the phone, stays on your phone until you allow the Department of Health access to it, and then you just hand over to the Department of Health the diary, that's why we call it My Location Diary, the diary of all the places you've been. This is version 1. Where version 2, and the other point is you should still keep your contact tracing notebook for the people you've been with, because this is just the locations where you've been. Future versions may have the ability to ping off of one another's phone. So if you're in a place where both of the people have enabled the app, then it could say, Gina's been near Brian, but we're not there yet. That is not what this is. This is just a location diary. It's like a Google map. It'll give you a series of addresses where you've been in the course of a day, stored on your phone, and then if you choose to, if and when you get sick, you can turn over the diary log.
Governor, how do you get the word out on this? I mean, should doctors...
what I'm hoping
well, I know
you guys
that,
help
but
me.
I mean, people don't know what a yield sign is in our state. Should stores prompt it? Should people say, hey,
Yes.
have you turn your app on?
No, thank you for saying that. Absolutely, yes. Yes. So today's the beginning. Today is day one, and we're launching it, and in about a month, we'll have version 2. So every employer, I'm asking every employer to encourage their employees to download the app, not to force them, but to encourage them. I'm standing up here, and I devoted the whole time to it because I'm asking every Rhode Islander right now, if you're listening, take out your phone, take 5 seconds, and download the app. Then shoot it to all your friends and family. Send it out to everyone in your contact list. Like, absolutely. We're just about to reopen churches. Every priest, rabbi, imam should be asking their congregants, download this. Not forcing, but absolutely. The more people who download it, the better off we'll all be.
Governor, the system monitoring data, that, however, is exchanged with the Department of Health every day, right?
What do you mean by system monitoring?
Your symptoms. So if you have a headache
How often
today,
is that uploaded? Like, I'm not sure how often that's uploaded. Let me find out for you and come back to you.
because ideally, don't you want someone to be telling you on a daily basis how they're feeling?
That is happening. I'm sorry. Yes, every single day you will be prompted to take a survey. Do you have a fever? Do you have symptoms? That and the question I don't know the answer to is how frequently that is shared with the Department of Health, and that's what I have to get you information on, because it's every day on your phone, and then uploaded on an anonymized basis, so the Department of Health can look at it by zip code, but I don't know how often the transfer occurs.
Governor, I asked earlier about how to verify the app does what it claims to and not. And
Yeah.
it's very common in sensitive applications like cryptographic messaging and so on to publish them as open source so that anybody could review the source code and see what the programmers have done. And I assume this is not that, but have you considered having a third party validate this like a banking app would be?
It's a good idea. We haven't done that, but I'm going to take it back to the team. Just like that additional layer of confidence for people to have. I think it's a smart idea.
Last question today from Kim. Not about the app, but about the letter that was signed by, I think, about 200 local restaurants asking you to open them to in-room dining on June 1st. Your response to that?
Yeah, it's a fair ask, and one that I would like to be able to make happen. It's very, it's consistent with what I've been saying. That's exactly between 3 and 4 weeks of when we started phase 1. So we're working like crazy to be able to make that a reality, and I hope we get there.
Would you be willing to offer hazard pay for servers or kitchen workers that are going back to work right out of the gate here right now, or June 1st if you do open restaurants for in-service dining?
Yeah. It's not something that I'm considering. I have been assured as recently as yesterday that in the next round of federal stimulus, that sort of hazard pay is very much on the table. It is more, I would support it, by the way. I think it's a bigger issue for healthcare workers. Like, it's a much bigger issue. Look, the fact of the matter is, if you're sick, you shouldn't be going out to dinner. If you're sick, you shouldn't be leaving your house. And if you are going out, you should be, wearing your mask, washing your hand, and the whole thing. So I'm open to it if the federal government provides the finances. I am more focused on those sorts of bonuses for people who are in the healthcare industry, who are in daily and close contact with people who are sick.
Sorry, I know yesterday you discouraged Rhode Islanders from hopping across the border to potentially get a haircut or go to church if Massachusetts opens faster. What would you say about people from Massachusetts or Connecticut coming to Rhode Island to eat outside or at Rhode Island restaurants if they open faster because they're not there yet? Would you discourage that and visiting the beaches next week too?
I think so, yes. I mean, they should follow whatever rules Governor Baker has set out for Massachusetts. And so number one, I'm encouraging everybody to follow the rules. And number two, in this phase 1, until on or about June 1st, yes, you should be sticking close to home and not crossing state lines for recreational purposes. If you're coming here to work, that's a different story. But hopefully, when we get to phase 2, which will be hopefully right around the June 1st timeline, we can look at relaxing that.
Thank you, everyone. We'll be back tomorrow.
Thank you.